We previously prepared our helmet, and this is it here. I'll just put the box out of the way. And what we're going to do is apply a viral filter to the expiratory port of the helmet. In this instance, our patient Max is sitting here and the CPAP machine is coming from the left side of the patient. So we're going to apply the viral filter to the expiratory port on the right of the helmet. You can tell where the front of the helmet is by the two ports here. So I'm just going to take this filter out, and we're going to apply the filter. Now this filter doesn't fit directly on. Some filters will and some won't. It will depend on the gauge of the connector. So I'm going to use a standard female to female connector adapter and apply that to the expiratory port of the helmet. So it's very important to make sure that any gas monitoring port on the filter is on the outside, so any gas being vented is free of virus. So the next thing we're going to do is remove the free breathe valve before we put the helmet on the patient. That just means that the inside of the helmet is open to air until we've connected up the gas supplies. Normally we have the helmet put on to a patient by two people, and I'm going to give the helmet to two of the nurses that we work with here, Louise and Tony, and they're just going to first of all loosen the front part of the straps. These straps will go under the patient's arm, and then if we just tip the helmet towards you, you'll see the elasticated neck seal, and they're just going to pull that neck seal into the perimeter rim of the helmet, and now they'll very gently pop the helmet down over Max. Best to close your eyes when this is going on. There we go. The next thing we're going to do is apply the straps. These go under the arm, making sure the padding is high up into the armpit, and then we tighten the straps at the front and at the back, making sure the patient is comfortable. Are you comfortable in there, Max? Now, the next thing we're going to do is fill the air cushions. So we have an air cushion at the head and an air cushion at the neck. Now, you can fill these with a catheter tip syringe, or you can use an air supply. For speed for this demonstration, we're going to use some oxygen from the wall, and we're just going to apply the oxygen to the tube. You can see the cushion inside is now inflating. We'll just check when that's comfortable for Max. Is it comfortable there?
Yeah,
and we'll just seal it off. Now we're going to do the same at the neck cushion, which you will see gradually inflating as we apply some additional gas. So the next thing we're going to do is connect the gas supply to the helmet. This is just coming from a normal home CPAP machine. And finally, we're going to put the free breathe valve on and seal this onto the helmet. And you can see the helmet gradually inflate as we do that. Are you comfortable in there, Max?
Yeah.
Now, for the purpose of the demonstration, although we wouldn't normally do this on the ward, I am going to attach a capnography tube to the expiratory side of the filter, just so that we can show that with the home CPAP machine, Max is not rebreathing any carbon dioxide. And we should shortly start to see a little bit of carbon dioxide in the expiratory gas coming through the helmet. That should plateau out around about between 4 and 7 millimeters of mercury. There will always be some carbon dioxide in the expiratory gas because Max is breathing out. If this number was rising, we'd be concerned that he was rebreathing his carbon dioxide, and we'd have to check the flows were high enough. But as I say, once we know that the characteristics of our home CPAP machine, and provided the flows are above around 40 to 50 litres a minute, there shouldn't be any rebreathing. We're not currently using any additional oxygen, and we can apply additional oxygen to the helmet using the CPAP machine. Tony is going to connect some supplemental oxygen to the CPAP machine, and we're going to set it to 15 litres per minute, and we'll see what the FiO2 is in the helmet on the monitor here. So with 15 litres per minute of oxygen into the helmet, and giving time for the environment in the helmet to equilibrate, we can see that we're now breathing out through the helmet, or expiring through the helmet rather, 34% oxygen. Now, as that should approximate to the concentration of oxygen in the helmet, 15 litres a minute of added oxygen is giving us around 34% oxygen to the inspiratory gases that Max is breathing. This is important because as we go on to show you an alternative oxygen conserving delivery strategy, what we'll see is that we can use the same flow to deliver far higher inspired concentrations of oxygen within the Suzy hood. You'll notice that we have got our home CPAP machine attached through a humidifier. At the moment we don't have the humidifier on, and it's not absolutely essential because the home CPAP machine is just compressing room air, which is already humidified at the ambient temperature and pressure for the environment we're in. However, because of the high gas flows, there is still a risk of ciliary drying in the lungs, and so we do recommend that you use the humidifier, and it's even more important to do that if you've added oxygen, because compressed oxygen is a dried gas. And so the humidity of the gas in the helmet will drop markedly the more oxygen you're adding to it.